going to tell you guys about dental x-rays. There are many different types and ways to take dental x-rays. There are bisecting techniques and paralleling techniques. The bisecting technique is usually used when you can't get at the tooth at a certain angle. So if there's tori or some dental or abnormality in the way, then you usually use a bisecting technique coming from a different angle. And the paralleling technique is when you parallel the tube head, which is the machine used to take the x-ray, and the film inside the mouth parallel. Then there's also film and digital. The film is placed inside the mouth with a film that you develop in the developer, and the digital is just sent right to the computer. Today I'm going to tell you guys about paralleling and film techniques. There are some materials that you need when taking dental x-rays with film. There's the PID, which is the machine you can see on your handout, and then the bite tabs and bite blocks. Bite tabs are used when taking bite wings, and then bite blocks are used when taking PAs. The bite tabs are placed in the middle, and the patient will bite down on it in the center, so it will show the mandibular and the maxillary, which is the top and the bottom. And then the bite block will be taken for the PA, which is just showing the top or the bottom arch. Then there are some major rules when taking dental x-rays with film. This refers to taking all the different x-rays. As you can see in the middle picture, there's a wet side and a colored side. The wet side of the film will always be facing towards the outside, towards the cheek, and then the colored side is always facing towards the tongue. There's a small dot when you look closely. There's a small dot shown on it, as you can see in your handout also. This dot will also be facing downwards towards the patient, the bottom of the mouth. When it's in the mouth, the dot will always go down. Then, if you look at the PID, you'll always need to remember to change the angle and the time, depending on where you're taking this x-ray in the mouth. Now, there are two different kinds of x-rays that we need to take in the mouth. There's bite wings and the PAs. The bite wings show the top and the bottom arch at the same time, and the PA is just the top or the bottom. The bite wing is shown here in your handout. This is what it's going to show. It's going to focus on the crown, which is the biting surface of the tooth, and the bone level. As you can see, in between the teeth, there's a grayish area, and that's the bone level. If the bone level goes down too far, that is not good, and we have to take a PA, which will focus more on the root, and this will show more of the bone level also. If the bone level is too low, then we'll need to show it in the PA. This will focus on the root. And in the maxillary, which is the top arch, we have the central PA, the lateral PA, and the canine PA. Then there's also the premolar and the molar. So there will be 5 in the maxillary. And then for mandibular, there's only the central, and then the canine, premolar, and the molar. So there's only 4. You will not need a lateral PA in the mandibular, which is the lower arch. When we put all these together, we put the bite wings and the PAs together, will form a full mouth x-ray, which is shown in the next slide of your handout. These will go together, and in clinic at NDSCS we do the 16-4, which means that there's 16 PAs and 4 bite wings. So the premolar and molar bite wings, and then the PAs, which are 5 on top, and then 4 on bottom. These dental x-rays are very important in the dental field because it allows us to analyze the anatomy that we can't see visually when we look right inside the mouth. It shows us what's underneath the gingiva and the bone level and anything we need to know to analyze with the patient.